Hello, I'm Dr. Rajesh. I'm a neurosurgeon from Karimnagar. Today, my topic is on Montreal Cognitive Assessment. What is Montreal Cognitive Assessment? It is a screening tool to test mild cognitive impairment, frontal lobe dysfunction, and early stages of Alzheimer's. Last time, we have discussed that it is more sensitive than MMSE, especially for early cognitive decline. What are the cognitive domains tested in Montreal Cognitive Assessment? These are the domains which are tested in Montreal Cognitive Assessment. One is visual spatial ability, second one is naming, third is attention, fourth is language, fifth is abstraction, sixth is memory, and seventh is orientation. The first one is visual spatial attention. It is given with 5 marks with for the correct answering. It consists of 3 tests, that is trial making test, cube copying test, and clock drawing test. Trial making test awarded with 1 mark, and cube copying is awarded with 1 mark, and clock drawing is awarded with 3 marks. Trial test consists of the patient is asked to draw a lines from a number to a letter sequentially. If he is able to perform the task correctly, he is given with 1 mark. In the cube copying test, patient is asked to copy a cube correctly, which exactly shown in the following image. If he is able to copy the cube correctly, he is given with 1 mark. In the clock drawing test, patient is asked to copy a clock with correct time. If he is able to draw circle properly, he is given with 1 mark. If he is able to number the clock properly, he is given with 1 mark. If he is able to draw the clock handles, he is given with 1 mark. And examination of naming. He is shown with 3 images. We will ask him to name them properly, and 1 mark is given for the correct answer. It consists of totally 3 marks. Examination of memory. During the examination, we will not award any marks to the patient. Actually, we will show him 5 names, and we'll ask him to remember those 5 names, and ask him to repeat the names twice. Whether he is able to repeat it correctly or not, he is not given with any marks during this examination. The marks will be given only during examination of recall. Examination of attention, it consists of 6 marks. It will be attention will be examined with 3 tests, that is digit span, second one is letter tapping, third is serials of sevens. In digit span, patient is given with a number, and we will ask him to repeat the number from forward to backward. If he is able to repeat it, and again we will ask him to repeat the same word in a reverse manner. If he is able to perform it correctly, he is given with 2 marks. And letter tapping test. In this test, patient is given with certain haphazard words like F, A, C, A, D, and we will ask him to tap when he listens A. If he is able to tap it correctly, then he is given with 1 mark. And serials of 7. In this test, patient is asked to subtract 7 from 100 for 3 times. If he is able to do it correctly, then 3 marks will be given to him. Language. Language is examined with following test. Patient is asked to repeat the words which are shown in the image, and he must repeat the words exactly which is shown to him, and 2 marks will be given if he is able to correctly perform the task. And the second is verbal fluency. Patient is asked to say the words as number as possible within 1 minute. If he is able to perform the task is that he is able to mention at least 11 words in a minute, then he is awarded with 1 mark. Abstraction. Examination of abstraction. It consists of 2 elements. He is shown with 2 objects. We'll ask him what is the similarity between these two objects? Example, in this image he is shown with train and bicycle. Both and the answer he has to given is both are meant for transport. And the second one is he's shown with watch or ruler scale, and the purpose is to measure. He has to answer like both are for measuring. So we are testing a abstract thinking of the patient in this test. In the other way of testing is abstract thinking and abstract reasoning. In the abstract thinking, patient is shown with two things and we'll ask the similarities between the both. If he is able to answer, we'll given with 1 mark. In the abstract reasoning, patient is given with a proverb and we'll ask him to interpret the proverb correctly. If he is able to interpret the proverb correctly, he is given with 1 mark. In the recall testing, last time we have given the patient with 5 words. We'll ask him to repeat those 5 words now. If he is able to repeat those 5 words correctly, he is given with 5 marks. Last cognitive domain to be tested in Montreal Cognitive Assessment is test of orientation. Patient is asked to recall the date, month, year, day, place and city where he stays. If he is able to answer it correctly, he is given with 6 marks. Normal scoring of the Montreal Cognitive Assessment is 30, and addition of 1 will be given if the education status is less than 12 years. So maximum score is 31. So in interpretation of Montreal Cognitive Assessment, the scoring of 26 to 30 is considered to be normal, and the scoring of 28 to 25 is considered to be having mild cognitive impairment, and scoring of 10 to 17 is having moderate cognitive impairment, and scoring of less than 10 is considered to be having severe cognitive impairment. Clinical example. In mini mental scale examination, a scoring of 28 by 30 is considered to be normal. But in Montreal Cognitive Assessment, it is considered to be abnormal. Like a patient comes to our OPD saying that, sir, I am forgetting the recent conversations. While examining this patient, he may have the score of 28, but with Montreal Cognitive Assessment scaling, his score maybe comes around 22. So the patient with normal scoring in mini mental scale examination cannot be considered to be normal. He has to be evaluated with Montreal Cognitive Assessment. With this assessment, even with a mild cognitive decline, we can pick up the diagnosis. Thank you.